Hello, I'm Rick Rail. I'm the Director of Pharmacy at University Behavioral Health of Denton. On April 17th, I will be presenting a presentation on connecting the dots. Why connecting the dots? Clients going to counselors often don't see what the important role medication plays in helping them get better. Vice versa, patients going to psychiatrists often don't understand how important it is to get counseling in the healing process. My presentation attempts to connect the dots from the psychiatrist to the client to the therapist. Goals and objectives today will be review the common drug classes used to treat their psychiatric illnesses, talk a little bit about the mechanism of action of medications in each of the drug categories, go over side effects and adverse effects associated with each class, discuss the relationship between diagnosis and medication and treatment. The psychotropic drug classes that I will be covering today will be anti-anxiety, drugs like Valium and Xanax, mood stabilizers, lithium, Depakote, Trileptal, stimulants such as Vyvanse, Concerta, Ritalin, Adderall, antidepressants like Zoloft, Cymbalta, Wellbutrin, antipsychotics like Zyprexa, Seroquel, Risperdal. I'll also cover alpha adrenergic agonists, which I think you better know as Intuniv and Capve. I'll be coming from a point of view that discusses everybody's brain chemistry as being unique. When you get an imbalance in the messaging system of the brain, you get an imbalance in neurotransmitters such as serotonin, norepinephrine, dopamine, GABA, which is gamma-aminobutyric acid. Serotonin is responsible for calming you down, making you feel like everything's going to be okay. Norepinephrine alerts you, it motivates you. Dopamine helps us focus, helps us pay attention, improves cognition. And GABA is a inhibitory neurotransmitter, which helps us to calm down, which is why it's the neurotransmitter involved with anti-anxiety drugs. Today I'm going to review medication management from the psychiatrist's point of view. I will discuss how they establish a diagnosis, how they ID the target symptoms that they're going to treat, and then how they monitor to the response that they're looking for and make adjustments along the way. Why they choose certain drugs over other drugs, utilizing criteria such as side effect profile, trying to reach the lowest effective dose. I will talk about compliance, which is coming to the forefront in medication management these days. I'm going to talk about it from the 5 dimensions of adherence. One being medication cost, how it's not affordable to pay for some of these really expensive medications. Lack of continuity of care, how you change doctors. Sometimes you can't get prescriptions for the medications you need. Lack of symptoms. If you don't have symptoms, you don't think anything's wrong with you, you stop taking the medicine. There's no immediate benefit that you realize. Sometimes in antidepressants, we find that they take a while to work, so we're still depressed and taking the medicine, so why continue? Or lack of insight, such as the anosognosia associated with schizophrenia, where they will never understand that they have a mental illness. This is one of my favorite presentations. I always love this because I learn from the audience because they ask lots of questions. And I feel like when the audience is asking questions, then they're engaged and they're learning, and so am I. And finally, it provides everyone a chance to ask these questions, and it makes me feel like they really are participating and getting something out of the talk. I hope to see you all there April 17th.